This attack on the nervous system can last for months, even years, but can anything be done to treat it? Here at Smart Medicine, we are going straight to the expert. Joining me now is Dr. Moasir Schnap. Dr. Schnap, thanks so much for joining us.
Thanks for having me.
Tell me what chronic pain is.
We used to think that chronic pain was just any pain that lasted longer than 6 months. What we assume now is that chronic pain is, more importantly, any chronic or severe pain that will disturb a patient's life.
Why do we need pain specialists?
Doctors are usually not trained in the treatment of chronic pain. Doctors, more often than not, don't like to treat chronic pain because of the lack of training. So we need pain specialists for that particular reason.
Why are we hearing more about chronic pain now? Before, obviously people hurt a great deal before. This is not something new.
We have a much better understanding about chronic pain now than we had, let's say, even 30 years ago. We know more about why people hurt, what can we do for it, how do different medications work. And now that we have a better way to treat patients, we have more to offer those people, and they come to the office requesting pain relief.
What is the relationship between depression and pain and sleep and pain?
Oh, and those go hand in hand. Anybody who has had chronic pain will develop sleep disturbances, but oftentimes they will actually develop depression. So we are dealing with a snowball mechanism. You hurt bad enough, let's say from arthritis. Every time one person turns in bed, wakes up, interrupts the sleep pattern, which makes the person hurt more. The longer a person hurts, the more frustrated, the more depression they get. And in fact, many of the chemicals that are related to depression are related to chronic pain. And the same chemicals used to treat one can often help the other.
Dr. Schnap, thanks so much for joining us.
Thank you so much.
So the moral of the story is get that chronic pain treated.
Yes.
Thank you so much for joining us. If you have a question